This meeting is being recorded.
Welcome and thank you for joining us today for the meeting of the New York City Health and Hospital Equity, Diversity, and Inclusion Committee. Today's meeting is officially called to order. Please note for the record that Dr. Shady Shamani is representing Dr. Ashwin Vasan in a voting capacity. Next on the agenda, I would like to propose a motion to adopt the minutes of the Equity, Diversity, and Inclusion Committee meeting held on July 11, 2022. Do I have a motion?
Yes.
Okay, all in favor?
Aye.
Anyone opposed? Anyone abstain? No? The resolution is approved. Thank you. Next, we are going to receive in a written format the diversity and inclusion update from Ms. Ibelis Mendez Justiniano, and that is in your packets for your reference. Thank you. Following, we are going to have a presentation on the Equity and Access Council by Natalia Cineas, Nicola Davis, and Brenia de la Cruz Cedeño.
Good morning. I'm Natalia Cineas, and I will be presenting on behalf of the Equity and Access Council this morning. Today's presentation will focus on workplace inclusion. We're proud to announce that New York City Health and Hospitals has established workplace inclusion groups. We know inclusion is the practice or policy of providing equal access to opportunities and resources for people who might otherwise be excluded or marginalized, such as those who have physical or mental disabilities and members of other minority groups. And so we've established our inclusion groups on the foundation of our mission, vision, and values. And our values are shared at the beginning of all of our inclusion group meetings. Next slide. Next slide. Next slide. Thank you. Our goals of the inclusion groups are to enhance employee engagement and innovation, to improve employee and patient experience, to improve leadership skills and abilities, to create a safe space for difficult conversations, and last but not least, to enhance cultural awareness. Next slide. So we've established 13 inclusion work groups: women mentorship, LGBTQIA+, anti-racism, advocates and allies, heritage and history, Hispanic Latinx, Asian American Pacific Islanders, African American, Caribbean American, generational, Jewish American, veterans, disabilities, Black female physicians, Hispanic Latinx physicians, and Black male physicians. We've established kickoffs, we've disseminated surveys, we've reviewed those surveys, we've established leads for our inclusion groups, we've established goals and metrics with leads, and we've established a monthly meeting cadence for all of our inclusion groups. Next slide, please. So the kickoff meetings were held between December 2021 through February 2022. We have over 20 attendees for each group. We've brainstormed ideas and we finalized top 3 projects for each of our groups. In order to establish these inclusion groups, we've sent out surveys that were essentially started because of the empowering employee voice sessions that we had during the pandemic. And those voice sessions essentially charged us with establishing these important inclusion groups. The survey questions that were asked of our employees were whether or not they wanted to volunteer, lead suggestions, leadership traits of the leaders, topic suggestions, goals, success metrics, and post-survey results in terms of meeting with the results with all members to ensure that the group is essentially on the same page. We then selected leads for each of the groups by reviewing the bios of potential leads with shared members. We established a SurveyMonkey poll. We met with the leads to establish primary and preliminary goals and success metrics. And we virtually met with the group leads and the members, and we also met in person. Next slide, please. We have since also established a consulting firm to help us with the inclusion group in terms of guidance. Some of the groups are meeting on topics that are very sensitive, and so we wanted to get external experts to help us in terms of gathering information, problem solving, effective diagnosis of issues, action recommendations, to implement changes, to facilitate learning, to identify metrics, and organizational effectiveness of these groups. Next slide. So as of today, we've collated a series of projects, approximately 158, but we have decided to ensure that each inclusion group will work on the top 3 group that are listed here on this slide. I will not go over all of the ideas that have been recommended by each group, but here you can just take a look. Some are self-care, emotional intelligence, finding your voice in the workplace, different educational workshops, and also mentorship programs and advocacy events and more workshops to ensure that we are really establishing a diverse programs across the system for all of our groups. Next slide. So today we wanted to give this amazing group an opportunity to showcase the work that they're doing. And so I have Brenia de la Cruz Sedeno, who will present the Hispanic Latinx Inclusion Group and their top 3 projects that they will be working on this fall. Brenia?
Thank you, Dr. Cenez. Good morning to all. My name is Brenia de la Cruz Cedeño. I serve as lead for the Hispanic Latinx Inclusion Group. First and foremost, within the group, we have established a mission and vision for guidance. Our mission is a task force leading to inspire, uplift, and collaborate with Hispanic Latinx communities and influencers towards a diverse and equitable workplace. And the vision being bringing health, equity, and wellness for all Hispanic Latinx members in the H&H community. And we were able to identify the mission and vision, aligning them with the H&H mission, vision, and values. Next is our Making Strides Against Breast Cancer initiative, which was held yesterday. Successfully, we have been able to raise over $650 through the American Cancer Society portal. The purpose is uniting communities for a common cause, raising money to fund life-saving initiatives when bringing awareness to H&H employees. So our success metrics was walk-in participation, the amount of funds raised, which we are calculating still, and our methods of engagement being announcements, word of mouth, and establishing supports from public affairs directors. Our following initiative as well to continue is our What is Hispanic Latinx?
Next slide.
Next slide, please. Thank you. Which is a workshop contextualizing the use of the terms Hispanic, Latina, or Latino to present-day Latinx. And the purpose of this webinar that we're looking to establish is to be able to destigmatize the conversations of migrants, Hispanics, identity, Latinx, Latini identifiers. And also for that, we have established relationships with CUNY leaders. We have also established relationships with leaders within the New York City Health and Hospitals Corporation, so that way we have proper reflection of what we're looking to achieve. And for that, we have established our success metrics to be the participation in the workshop, live QA, registration, as well as methods of engagement being through the insider page and leveraging all of the resources we can within the system. Thank you. That concludes our report.
Thank you. I would like to open up the floor to the members if there is any questions. Jose?
More than a question, just a comment and congratulations. I mean, it's pretty impressive that you were all able to put together this group so quickly and that there's so much interest from what I can gather among staff, and just the diversity of topics and everything from making sure that people feel included and are part of it to all the way like very concrete ideas and letting the groups develop their own ideas is interesting. Are there any groups that happen to be or more active by any reason, for whatever reason? Do you have information on that, or just curious about that?
I would say the level of activity is based on when they were established. So those that were established earlier on have more happening. But we guide all of the groups to ensure that there's an even playing field in terms of the programs that they will, run across the system. But I think overall, they've all been really impressive. The work that they're doing, Black female physicians, led by Dr. Davis, is really phenomenal. Just all of them. I have no favorites because they're all great. Yeah, they're all great.
So again, congratulations. I'm pretty impressive, and I look forward to learning more about it, how they evolve.
Thank you.
Thank you. Frida?
I also agree. I loved the projects, like the diversity and having the groups identify them themselves, and you see how different the interests are and the focus areas, and I think it covers a real interesting breadth of activities. And I had a question on, and you may have said this and I just didn't hear, the 13 groups that we have, was that something that the council decided we'd have these groups, or it was kind of selected, people said they wanted to create groups and,
Self-selected based on the surveys.
I see.
So there are approximately 3 more that the steering committee's considering. But we work very closely with labor relations and HR and all of our clinicians to really think about the level of interest to ensure that individuals are not working in isolation.
Right.
And then we then support them to establish the group. But essentially, these all came from our employees.
Okay, interesting. And then they will work collaboratively, because you said in isolation, lots of people might be doing different things, and I think the collaboration amongst the groups is also really.
Absolutely. So we have a couple groups who are actually partnering to develop programs together, which is nice to see.
Right. And I think you had mentioned in your comments, Natalia, that every group has a lead and has sort of been launched, but just on the checklist, it looked like there were some that didn't. Is that been?
Well, they have to vote on their lead. It's a
I
very
see.
interesting process. So you're either, you self-nominate or someone nominates you, and then we have to review the bios.
Right.
And based on the leadership traits, they then vote on the lead.
I see.
So it doesn't happen overnight, and it's really important because of the sensitivity of this work that we identify the right leads.
Right.
It's actually 2 leads for every group, but essentially all of them will have leads.
I see. Okay. So it's not that some are not active, it's that they're just all in different stages
They're
of
all
development.
phenomenal leads. Yeah, so they meet with myself and a project manager every month to go over where the groups are and how are their meetings going, and then whether or not they need additional support, what resources do they need, and then I escalate that to our amazing steering committee
Right.
to ensure that they're supported in the right way.
Great. Thank you. I too look forward to the work coming out of it. Thanks.
Any other questions? Yes, please.
Hi. So I have a question.
Sure.
Labor relations is involved. Is that in part related to just making sure staff have time and space to work on this? Because people are volunteering. So I was just curious, like, do
Right.
people get relief of time, or is this on top of their normal
They get
work?
released. It's a volunteer.
Okay.
Aspect, but labor relations is involved because some of the projects that come up may be, related to our employees. So for example, what is the sensitivity around establishing more gender neutral bathrooms? So we might need legal to weigh in as well. So I think having a diverse steering committee helps with the decisions we make. We have, and one thing I think the labor relations has been instrumental in reminding us that it's not only about our employees, but also about our patients, and ensuring that we're educating one another about ourselves so that we can then improve the patient experience. And so I think that's where labor has really come in from a legal perspective, not necessarily issues with employees.
Thank you. Any other questions? I just have a comment. I really like the workshop that you have on kind of representing or discussing the terminology of representation or identification for Hispanic, Latinx, Latine, whatever we may want to call ourselves. Because I think it's important that we as a group, particularly in Health and Hospital, define how we want it to be called. A lot of times we know historically this terminology has been imposed somehow on different groups, and the groups kind of adapt to it. But I think we are at a time that we do have to ensure that we communicate how do we want it, if we want it to be called. And I think this conversation is very important. I see that is in a form of a webinar. I hope that there is time for discussion and to be able to get everybody involved to share their opinions on how they want it to be identified. Thank you. And I think we do have, Ibelis, I'm sorry to do this to you. I apologize. But if, since we don't have any other topic here, I know that we kind of accepted your report in writing, but I think you had some very interesting information to share. If you can select some of them, maybe not go over the whole presentation, but the highlights, and so just ask the Jenny that is controlling the presentation when she needs to skip. I think it will be good for people to hear the great work that your group is doing in ensuring that all our staff and employees feel welcome, appreciated, and respected.
Thank you very much. So if we can advance to slide number 5. So this report will include some highlights of my written report. And we'll start off with the medical interpreter skills training because we've had significant growth in that particular program. So the first year that we had the program, we had a total of in excess of 144 applications. And the 2022 participant ethnicity breakdown was 64% Hispanic, white 11%, Asian 9.5, Black African American 8.5, Native American Alaskan Native 3.3%, and unknown 4. What's interesting about the medical interpreter skills program is that it's multidisciplinary. So participants participate on a volunteer basis. The top titles across the system were clerical associates, nurses, coordinating managers, assistant coordinating managers, community liaison workers, patient care associate technicians. And so what makes this interesting is that now we have a cadre of additional staff who's poised to serve as providing interpreter services on a volunteer basis when needed. Now, this year we launched a new cohort for the MISS training, and we've been able to expand the program. So when we initially introduced it, it was Spanish only. We now have expanded to Russian as well as Mandarin. And so again, the Hispanic population, the Spanish interpreter skills training was the largest, followed by Mandarin and Russian. So these individuals right now are in the process of getting assessed. Every applicant is assessed for their language fluency. If they meet the level of fluency, then they're accepted into the program themselves. So it's not just based on an application and self-attestation that you speak the language. Once these individuals are accepted, they will go through an online program followed by coaching to assess that what you learned on the online has made you now a person that's able to serve as an interpreter. We received a total of 307 applications. Of those, 268 were completed applications and sent to our partner vendor, which is Alta for testing. And the breakdown is 223 in Spanish, 20 Mandarin, and 25 Russian. In terms of the Food and Nutrition Educational Assistance Program, so we do have a program that is made available. We have an educational trust focused on food and nutrition staff. This covers certificates, tuition assistance, professional dues, and it's for staff represented by DC 37 and 1199 working under food and nutrition. For FY 2023, we've actually disbursed $25,393. The total amount disbursed from 2018 through FY 22 was $293,000. And so what does that mean? That means that we funded degree programs, certificate programs, professional development programs for a total of 63 employees. The schools that we funded included BMCC, Hostos, Kingsborough, LaGuardia, Lehman, and New York City College of Technology. Based on that, we have the breakdown included. And when we look at the breakdown of the entire ethnicity under the food and nutrition staff, based the ones that are using the program, we see that the highest percentage of staff that's using the program is of white background, followed by Asian background, and then Hispanic and Black African American are at 13%. So what does that tell us? We have to increase our outreach, which we are doing. We are going out to the facilities. We are making the food and nutrition departments aware that this fund does exist. We're participating in symposiums throughout, and we've developed an online process and also a special area within our Learning Academy site where individuals can go, they can access the application, they can reach out to us to ask any questions and to get guidance in terms of what's available for them in their professional development. We've also held...
Evelise, I think this is a good thing since there are some questions. Is that okay? Sally?
Yes, I had two questions. On the medical interpreter skills training, in another part of your presentation, you mentioned that Bengali was very highly spoken, and I just was wondering why, maybe it was in fewer institutions and Mandarin and Russian are over a wider number of institutions. Is
So
that
you're
right?
exactly correct. So if you look at the system-wide demographics, the top languages are Spanish, Bengali. Actually, Bengali is at Elmhurst Hospital. If you look at the system as a whole, it's Spanish, it's Mandarin, and Russian.
Got it.
So it was a combination of what were the needs within the system and what was also vendor availability. And so we matched that, and the number of employees that applied were those numbers, were the persons in those categories.
Okay, and then a second question about your food and nutrition educational assistance fund. Did you list how many people applied? Maybe I missed that.
I didn't hear the last part.
How many people applied?
Oh, how many people applied? Yes. So in the food and nutrition, oh, I don't have that in the presentation, but I can definitely get that to you. For
Right.
the most part, everyone that applies gets accepted for food and nutrition. The only requirements are that you're in the necessary title. It's a food and nutrition title. That you are a member of in good standing, so you have to have a good performance evaluation, and you have to be in active status. So you physically have to be working. If you're on any type of leave, you have to wait to come back into service. But if you apply, we process you.
Okay, so you're just gonna do more extensive outreach to draw in a more reflective.
Absolutely. So what we've done now is we've participated in several symposiums. Whenever it's Food and Nutrition Week, we've developed an online system so individuals don't have to do a paper application. They can just submit their information to us. But I also have staff going out into all of the facilities, speaking at the staff meetings for food and nutrition. So we have a more grass-based approach, who's individually, just in terms of going there and speaking to people one-on-one, because we understand that the food and nutrition population, they're not necessarily at their computers. So we have to have those one-on-one conversations, participation in staff meetings, and we've also participated in town halls so that we have a variety of mechanisms to really market the program.
And how much money do you think you'll have available this year?
So we receive an annual amount of 150,000 per year. So we'll have funds, and this is an education, it's a trust fund that's specifically for this population.
Great, thank you.
Thank you. Yes.
I just wanted to ask a follow-up to that. So, down the road, if Elmhurst says, you know, we really still want to do this for the Bengali language, does Alta have do they actually have the ability for the training course or not?
So we would, if we want to focus on Bengali, absolutely, we start the conversations with
Okay.
them. And if they don't have them, they're our vendors, so we'll work with them to
Okay.
get it if we need it.
Thank you. Frida, do you have a question?
Well, I didn't want to, it was on a page that,
No, it's okay. I think it's better. She's only selecting a few slides, so it's good to ask the questions.
and it occurred to me because I love this breakdown of who's participating in the food and nutrition fund and what the staff makeup looks like. You also provide statistics on other things, for example, the training on who participates in the training. Would it be possible to show maybe next time the relationship to how the staff break down, you know, because to see there's the participants in the training, we have the breakdown, but how does that relate to the makeup of our staff?
Oh, sure, we can
Really
report that
interesting,
next
yeah,
time.
thank you.
Isn't that this paragraph next to it or not?
That's for the food and nutrition.
Oh.
I was talking about on the prior page, or prior section on training, for example. Because I saw it in the food and nutrition, I thought that was interesting. To be able to identify where maybe we can do more outreach and see why people aren't participating, yeah.
Any further questions?
I have
Yes, Jose?
Just a quick question on the financial, I know you didn't talk about the financial workshops, but I wonder whether there's a high demand for them and how do you deal with differences in language and so on, given how markets are now, I'm sure, and inflation and all of that.
Can you mention the last part? I didn't quite hear.
The financial workshops, just in general, how they're structured, and also how do you deal with language differences, you know? Because you
Oh,
mentioned
absolutely.
Korean, Russian,
Yes.
Tagalog.
So the financial workshops are done in partnership with our TDA partner, which is Prudential has now gone over to Empower. And so right now, they've been providing us second languages in terms of their staff availability. We're currently working with them to identify our highest needs in terms of languages so that in future sessions, we'll be able to expand the number of languages available. In terms of how they're actually being executed during the session, the individual that presents the session is actually a dual speaker. So there's English, Spanish, or Bengali, whatever they have that's a second language. And so if questions come up or anything is needed in a second language, they're able to respond to that as well.
Thank you. And I just want to follow up on the question that Frida asked, because I think this data, I know that is a lot, and thank you for the breaking down. If we look at the medical interpreter skill training, for example, seeing the top titles, like the clerical associates taking on this responsibility, I think it can be quite interesting because you have a pool that will not be necessarily like the one that you will think of normally. So I'm going to the Food and Nutrition Educational Assistance Fund. Actually, it also was very interesting to see some of the kind of the differences on the makeup of the population as a whole and the people taking advantage, and how specific program for outreach of the Black and African Americans and males to be outreach. So I think another meeting, maybe you can share with us the strategies that you're using to reach out to some of the groups that may be not utilizing these services as much as we would like. And I think that will go also for the financial training. So thank you. I think we only have any other questions? Yes,
Quickly,
Sally,
the
yes?
mentoring program, which is exciting to see how it's growing. What is your sense on the expanded nursing mentor and physician mentor programs? Are those likely to be coming in?
Oh, yes. So Dr. Cineas and I are working very closely together on the mentoring program. And just to give you a little history in terms of the growth that we've had just in the last 6 months, we started off with a mentoring program focusing on our retired nurses coming back and serving as mentors to our new nurses.
Right.
That was a beginning phase just on the nursing side. That has now grown. We're looking at leadership strategies, so we're looking at developing an expanded mentoring program focusing on developing leaders into developing nurses into future nursing leaders. So we're putting together the framework for that. We've already distributed surveys in terms of who's interested. We received an excess of 500
Wow.
responses from nurses just for that program alone. So I predict that the growth is going to be ongoing. We actually, on October 27th, is National Mentoring Day, and so we're holding an information session for the system who's interested in mentoring, telling them about the framework that we've created, and inviting individuals who are interested in becoming mentors, so that as a first step, we can train the mentors to be mentors.
Great.
Once we have that pool of mentors in place, we can continue to expand to our non-mentors who will be our mentees.
Right.
In terms of physician expansion, I actually met with Doctors Council about 3 or 4 weeks ago and presented as part of the quality improvement meeting professional development opportunities, and they've just reached out to me. They're very interested in formulating a mentoring program for their education and professional development needs.
Terrific. Thank
We
you.
also have a clinical track for the
Yes.
nurse leaders, for the nurses that want to become nurse practitioners as well, from a clinical perspective.
Oh, okay.
So mentoring in all has been one of our, as you can see, we have tremendous growth we're experiencing in all the programs, but from the moment that we introduced mentoring, it has just taken off on its own.
That's exciting. Thank you.
It is exciting.
Thank you. Any question? I just follow up on Sally's comment. In earlier discussion in this committee, we have also looked at the pharmacists and some of the demographics in that group. I don't know if there is any discussion in looking at how to outreach, and I don't know if the mentorship program may be good in some of the areas in that one. So I will be very interested in learning more about what are we doing with our pharmacists.
Sure. So I have had initial conversations with Danielle Dabari, and we've started talking about strategies that we can incorporate to do that. So I'll be happy to report on that in future meetings.
Yeah, because some of the numbers were quite interesting in terms of really the demographics of the pharmacists. What I would like to do, because I think I know that we have a very full day today. I think thank you for highlighting some of these programs, and I think you can see from the members there is a lot of interest in learning more about it. Perhaps we can set up an informational session in which we can walk through the different programs and the accomplishment and the strategies, particularly I think the strategies that you're using to outreach groups that may not be taking advantage of the great programs that you have, and that they will benefit greatly, and most importantly will benefit our patients and our community. So if that is okay, maybe we can arrange that. And with that, I would like to ask if there is any old business, any new business? No? In that case, without further discussion, this meeting is adjourned. So we break.
3 minutes.
This meeting is no longer being recorded.